I first did palliative care when I was a student. Now, at first I thought I'd be afraid of it, but it was the part of the placement that I loved the most.
And I think Albany's been the perfect spot to experience palliative care firsthand. Having done a year of prac last year in Perth, I never got to see this. I never got to see what it was like for a palliative care team to come into a hospital and organise the care, whether the patient goes home or to hospice.
Working at hospice has given me the skills to communicate so well with a wide variety of people in some very difficult situations. When you're nursing in the acute area, it's so focused on cure and set rules and medications and observations, whereas with palliative it's about how the patients are feeling.
Before I came here, I was dying. Well, it's given me a second lease on life.
In terms of death and dying, at first you feel like it's a really sensitive issue. You don't really want to talk about it, but once you let go of that feeling, you can have such open conversations with people and achieve a lot in those conversations.
And at the end of the day, like, this is their life. They're already coming to terms with their own issues. They don't need you to be, awkward or tiptoeing around them. So having that palliative care experience is really crucial to being able to manage and communicate with patients appropriately.
I think the experience makes you a lot more comfortable in the situation where you need to be able to be effective.
The hospice was your starting point of recovering.
It was very invigorating for me. It helped me to think about how I would like to spend the rest of my life.
The hospice is a wonderful place that a lot of people don't know about. And I think more young people should volunteer to see what a wonderful place it is, not only to work in, but how they relate to people that are in their last days of their lives.
I guess the first time I was in a palliative care situation, I was very out of my comfort zone. I didn't really know what it meant, and I always perceived it to be this kind of waiting game where you're just kind of with someone at the end of their life. But I'm amazed at how active a process it is, where you're constantly seeking different options to get their symptoms under control and to optimise their care at that part of their life. And I think it's incredibly rewarding to be involved in that.
Yeah. In all honesty, I found it intimidating when I first came in contact with someone who are at the end stage of their life in this palliative care process. But like you said, it's a rewarding position to be in, because you can really make a difference in that person's life, and it's something to be celebrated and not be afraid of, and embrace it.
Yeah, I agree. I think the person's afraid of it enough that you don't need to be afraid of it too.
And I find they're so vulnerable, and we can actually give them some control. Feel very satisfied at the end of your day that you've given all you can to the patients.